What if I told you that 75% of healthcare professionals feel unprepared to provide the care that matters most when curative treatment is no longer an option? Every single day in the ICU, we face moments where our role shifts from fighting death to ensuring dignity. And if you don't understand the critical difference between palliative care, hospice care, and end of life care, you could be failing your patients when they need you the most. My name is Neil Brian Galvey, and this is NurseBrain, where we give you the confidence to succeed in critical care by breaking down complex topics and making them easy to understand. Now, if you don't want to miss out on any future lessons that could literally change how you practice nursing, make sure and hit that bell icon. Here's what most people don't realize. End-of-life care isn't just about the final moments. It's a comprehensive approach that can span days, weeks, or even months. And the decisions you make as a nurse during this time don't just affect your patient. They impact entire families for years to come. In this lesson, I'm going to walk you through the 3 critical components every ICU nurse must master. First, understanding what end-of-life care actually is and how it differs from palliative hospice care, because yes, they're different. Second, I'll break down your specific roles and responsibilities that can literally mean the difference between a good death and a traumatic one. And third, I'll give you the practical tools and communication strategies that will make you confident in these challenging situations. But first, let me share something that might surprise you. Every individual who opens their eyes to life at birth closes their eyes to death at the end of life. That's a profound truth from recent research, and it sets the foundation for everything we're about to discuss. Now, here's where most healthcare workers get confused, and this confusion can be dangerous for our patients. End-of-life care, palliative care, and hospice care are not the same thing, despite what you might have been taught. Let me break this down for you. Palliative care. This is a patient and family-centered care that optimizes quality of life. But here's the key. The patient can still have a chance of recovery. You're providing symptom management alongside curative treatments. The patient doesn't need to be dying to receive palliative care. Hospice care. This is specifically for patients with a terminal prognosis and less than 6 months to live. It's comfort-oriented care, usually provided in homes or specialized facilities. Curative treatment has stopped being effective. End-of-life care, and this is where it gets interesting. This is provided when death is very close, from the moment curative treatment no longer brings benefit until the patient's final breath. The focus isn't on prolonging life, but on preventing suffering and ensuring dignity. But here's what's critical to understand. End-of-life care can be provided anywhere: your ICU, a medical floor, at home, in hospice. Location doesn't matter. What matters is the approach. And research shows us something heartbreaking. Patients prefer 2 pain-free days over 2 years of suffering. Think about that. When we continue aggressive treatments that aren't helping, we're not being heroes, we're prolonging suffering. Now, here's where you come in and why your role is absolutely crucial. As a nurse, you're not just a bystander in end-of-life care. You're often the key decision maker who determines whether a patient experiences a good death or unnecessary suffering. Let me explain why you have this power. First, you're the observer. You spend more one-on-one time with patients than any other healthcare professional. You're the first to notice when treatments aren't working. You see when a patient is suffering from interventions rather than benefiting from them. This makes you the early warning system for when it's time to transition from curative to comfort care. Second, you're the translator. Families are often confused, scared, and clinging to hope. Doctors might explain medical facts, but you're the one who helps families understand what those facts actually mean for their loved one. You bridge the gap between medical reality and human understanding. Third, you're the advocate. When a patient can speak for themselves, you become their voice. You protect their dignity, their wishes, and their right to a peaceful death. But here's what the research tells us about your specific responsibilities, and this is where it gets really practical. In your manager role, you coordinate with the healthcare team, the family, and other disciplines to ensure everyone is working toward the same goal, the patient's comfort and dignity. In your decision-making role, you help bring together all stakeholders to make informed decisions about transitioning to end-of-life care. You're not making the decision alone, but you're facilitating the process. As a patient advocate, you ensure the patient's rights, preferences, and dignity are protected throughout the dying process. But here's something beautiful that research has shown. When nurses embrace these roles professionally, patients end their lives in hopeful environments where they're honored, respected, and surrounded by loved ones. That's the power you have. Alright, so now you understand the what and the why. Let's talk about the how, because knowing this information is useless if you don't know how to apply it in real situations. First, let's talk about the transition conversation. This is often the hardest part, and it's where most nurses feel unprepared. Here's a framework that works. Step 1. Assess understanding. Before you say anything, find out what the patient and the family already understand about the situation. Ask questions like, what is your understanding of your loved one's condition right now? Step 2. Provide information gently. Share medical realities in small, digestible pieces. Don't dump everything at once. Use phrases like, I wish I had better news to share with you. Step 3. Respond to emotions. When families get upset, and they will, acknowledge their feelings. I can see how difficult this is for you. Don't try to fix their emotions. Just validate them. Step 4. Discuss goals. Help them shift from what can we do to your loved one to what can we do for your loved one. This is a crucial reframe. Now, let's talk about the actual care provision. End-of-life care has some specific priorities. Pain and symptom management. This is your number one priority. Effective pain management isn't just about medication. It's about positioning, environmental control, and emotional support. Research shows that when pain isn't managed effectively, patients become hopeless and withdrawn. Maintain dignity. This means respecting their autonomy as much as possible, keeping them clean and comfortable, and treating them as the unique individual they are, not just a dying patient. Family support. Remember, end-of-life care includes the family. They need education, emotional support, and practical guidance about what to expect. Environmental management. Create a calm, peaceful environment. Dim harsh lights. Reduce unnecessary noise. Allow family presence. And when possible, honor cultural and spiritual preferences. But here's something crucial that most nurses don't realize. You have the power to ensure no one dies alone, even when family can be present. Your presence during the dying process can make the difference between a peaceful death and a traumatic one. Now, let's address the elephant in the room. There are some common challenges that make end-of-life care difficult, and I want to give you the strategies to handle them. Challenge number 1. Family members who can't accept the reality. This happens all the time. Family members demanding everything be done even when everything is causing suffering. Here's your approach. Focus on what you can do for the comfort rather than what you can do to cure. Reframe the conversation around providing the best possible care for their loved one's current situation. Challenge number 2. Physicians who are reluctant to transition to comfort care. Sometimes, doctors struggle with this transition too. Your role is to present objective observations about the patient's response to treatment and quality of life. Document everything, present facts, not opinions. Challenge number 3. Your own emotional responses. This work is emotionally challenging. It's normal to feel sad, frustrated, or even helpless. But remember, providing good end-of-life care is one of the most meaningful things you can do as a nurse. You're ensuring dignity in life's final chapter. And here's something that might help. Research shows that patients who receive quality end-of-life care often have better outcomes for their families too. Families experience less complicated grief, less depression, and better long-term adjustment when their loved one had a good death. So let's wrap this up. End-of-life care isn't about giving up. It's about shifting our focus from quantity of life to quality of life. It's about ensuring that when curative treatments are no longer beneficial, we provide care that honors the person's dignity and reduces suffering. Your role as a nurse in this process is absolutely critical. You're the observer who recognizes when it's time to transition. You're the advocate who protects the patient's wishes. You're the coordinator who brings everyone together, and you're the caregiver who ensures no one faces death alone. Remember, every individual deserves to die with dignity and peace, regardless of where that death occurs. Whether it's in your ICU, on a medical floor, or anywhere else, you have the knowledge and the power to make that happen. The care requirements and priorities of individuals at the last moment of their lives differ, just as they do in life. But with end-of-life care, our purpose is clear: support vital functions when appropriate, ensure pain-free time with loved ones, and maintain dignity throughout the process. If this lesson helped you understand end-of-life care better, please leave a like below. It really helps other nurses find this content. And if you know someone who could benefit from this information, share it with them. Make sure you subscribe for more critical care education that will give you the confidence to succeed in the ICU. And check out the lesson I'm linking right here about communication strategies in critical care. It's going to complement everything we talk about today perfectly. As always, thank you so much for watching. And remember, you have the power to ensure every patient experiences dignity in their final moments. I'll see you in the next lesson. Once again, this is NurseBrain, inspiring greatness one lesson at a time.